Hey, this is Mary Marzoff, and this is my case presentation of a patient with ear pain. My patient is a 38-year-old male Caucasian coming in with a chief complaint of right ear pain. He states that his ear has fullness and he feels that his hearing is diminished in that right ear. This has been ongoing for the past 2 weeks. He states that his ear hurts when he puts a Q-tip down in it and it has drainage on the Q-tip that is purulent and it smells bad. His review of symptoms: he denies fever or malaise. HEENT, he denies pain in his head, eyes, left ear, nose, throat, or neck. Complaint of right ear pain with yellow discharge. He denies nasal drainage, tooth pain, or a sore throat. As far as lymph system, he denies swollen tender nodes in his head or neck. Cardiac, he denies chest pain, palpitations, shortness of breath, or edema. Respiratory, he denies shortness of breath, chest pain, cough, or wheezing. His past medical history is positive for GERD, gastroesophageal reflux disease. His social history: he's married and works full-time as a welder. He has 2 children who live with him from a previous marriage. He's a non-smoker, occasional drinker, and no illicit drug use. He exercises at the local YMCA and swims 2 to 3 times a week there. He's allergic to penicillin, and he takes Prilosec 20 milligrams once a day for his reflux, and then he takes Aleve PRN pain. Physical exams: temperature is 98.8, right ear painful when touched, especially on the tragus, redness noticed in the outer ear. The ear canal exam shows redness and edema with yellow drainage noted. The eardrum can be visualized with no tympanic membrane rupture noted and with no redness or bulging of the tympanic membrane, and the light reflex is seen. The left ear was examined and was within normal limits. The left and right ears are visualized with no redness or drainage noted. No complaint of sinus drainage or pressure. The sinuses are palpated with no complaint of pain or tenderness. Lymph nodes of the head and neck are palpated with no adenopathy or tenderness noted. Throat was examined with no redness, swelling, or exudate noted. Good dentition is noted with no caries. The TMJ joint was palpated with no tenderness or crepitus noted with range of motion. Heart and lungs were auscultated and were within normal limits. Differential diagnosis would be otitis externa, acute otitis media, tympanic membrane rupture, cerumen impaction, foreign body, or TMJ disorder. And I'm going with otitis externa. And as far as diagnostic testing goes, we could do a specimen and look at it under the microscope to rule out a fungal infection, and we wouldn't culture it at this time unless he fails this first course of antibiotic ear drops. So the treatment plan is to keep water out of the ears for 4 to 6 weeks, no swimming until his symptoms are resolved, and only then with water-resistant earplugs. He needs to use cotton balls coated with Vaseline when showering to prevent water in his ear. He will be given a prescription for antibiotic drops, cortisophorone otic suspension, 4 drops in the ear 4 times a day times 7 days, and use Tylenol, Motrin, or Aleve for pain, PRN. And he's to follow up in 2 weeks, call office for fever over 100, or if his pain is not resolved in 3 days, or if he's having severe ear pain. And then as far as teaching for this patient, you want to teach him to clean only the outer ear as needed. Do not insert Q-tips into the ear canal, which could lead to further trauma. And after swimming, to use a hairdryer on a low setting to dry his ears. And he can also use a 1-to-1 solution of alcohol and vinegar in the ear twice daily or after swimming to prevent further otitis externa infection. Thanks.